a tennis ball, a lacrosse ball, something that can get in and provide some pressure there. Usually once we get that rolling and we're able to start to incorporate some exercise, might be some light stretches, some light mobility work, and then eventually trying to load that baby up. Which is one of those things where you can do it kind of early, and we can do it to a point where we feel some stuff on that side as long as it stays manageable. Usually just trying to build the overall capacity of that elbow, knowing that when it comes time to play, it's got to tolerate a lot.
Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Welcome back, everybody, to the Functional Code. We have a special guest here, Landon Uetz. He is a doctor of physical therapy. We're super excited to have him because he is a pickleball player specialist. We're going to talk today on how to bulletproof the pickleball player. Landon, thanks so much for having you. I mean, we are super excited to dig into this. Former All-American college baseball player. You've been working down here in Scottsdale, but you also have your own virtual rehab and performance training program specific for the pickleball player, but I'm sure you see a lot more patients too. He's been featured in National Geographic, Parade, and good. He's been featured on major news networks, so super excited to pick your brain today. As always, I am Dr. Addy.
I'm Dr. Jace. So we're thinking about different guests to have on the podcast, and I've known Landon ever since the University of Jamestown back in North Dakota, where he played baseball, obviously All-American. I played soccer, so we had mutual friends with that and just kept track of each other as we both moved down to Arizona. And I know we'll get into this later in terms of PT versus chiro, and I have so much appreciation for all that you do. I think there's a lot of specifics that physical therapists in general, that's honestly, they don't get at times the best rap, and there's the job that you do is so important and different than some of our line of work. But man, I thank you for all that you do, and I'm curious to pick your brain on a few of these things. But why did you choose physical therapy?
Yeah, first, thank you guys for having me. Appreciate that, and that introduction was awesome. Trying to remain a little humble.
Nothing like that today.
Don't feel super comfortable with you throwing all those accolades out there, but yeah, I appreciate it. But why did I choose physical therapy? I feel like the cliche answer that everybody gives is that at some point in life you want to help people. I think that's no different than me, whether that's in high school, college, at some point along the line, we all have that desire to help. Then it depends on what that looks like. I don't know if you remember, Jace, I spent a semester in nursing school at UJ, which that was my initial thought. Like, maybe nursing is how I'm going to help people. Spent the semester, realized it wasn't for me, looked somewhere else, and then dove into some of the other professions that I could be targeting. And then had an experience with a physical therapist myself, dealt with some injuries through college, like a lot of people do. And then I felt like that was something I wanted to model my career after. I feel like it takes one mentor to be able to dive full head on in. And that's the same thing that happened with me. It just took me a little later. It took me a little trial and a couple other fields before I figured it out, but we're here.
Was there a specific injury you had that you sought out a PT?
Yeah, I've been relatively lucky most of my career with injury-wise, but there was one, I believe it was the second year of college. I dealt with a lingering back injury that was hanging around for a lot longer than it should have. I want to say more than like a year and a half. Bounced around to many different people trying to figure out what was going on. Yeah. When in the meantime, I don't know if I want to say I didn't really know much about it. I was a 19-year-old kid who was not doing everything they needed to do off the field, out of the treatment room in order to make those gains, but turned out to be just like a stress reaction in the lumbar spine. Nothing super, super scary, but it was something that I never really just fully recovered from until I sat down and felt like I had the confidence in somebody to carry out their plan. And a lot of it honestly was done relatively remotely. I saw the individual in person, then I commuted back to North Dakota, and then communicated with the guy through phone and through email. Totally off the books, which was super nice of him. But I think he just provided me the confidence that I needed. And from there, it just was something that finally was able to get right. And
nice.
I haven't really had troubles with it since.
So you had some virtual training experience early on. So you had that experience, and did you think that also translated to what you do today too?
Honestly, like I didn't even really think about it until
Okay.
I've started doing this. And I think back, and it was just the individual. I saw a specialist in California. I wasn't going to stay out there over the course of a plan. And the expectation was to provide me with a program for me to carry out individually. But I think just providing updates through some of those means was super helpful for me. And it felt like I had somebody that was in my corner, was listening. I trusted them. And I think that was what I needed. And then just happens to be that I'm here now providing some remote
Right.
services. It was not intended, but
Awesome.
it kind of works out like
100%. So in terms of like your philosophy, so obviously that might change. I know for us, we talk about it often in terms of what you learn in school versus what you learn in like practice in everyday life. And there's a huge difference for most of us. But has your philosophy changed in terms of physical therapy in general?
yeah, I think it has, and everyone's probably should. Once you leave school, I feel like you get that outside, that kind of big framework of thoughts, ideas, beliefs, and then things that you can use to treat somebody. But then when you get in the real world, things change a little bit. Science changes, and I feel like we should be changing with it, which is super, super important. But for me, I feel like the big thing that I've learned, so to speak, or I've tried to develop is like more pain in general, how it's very unique. We don't always know a lot about it. We think we do, but sometimes we don't. And then there's a lot more to the person than what they're coming in with. If somebody comes in with elbow pain or shoulder pain or back pain, or they reach out to me with one or the other, that impacts them in a variety of ways. That's just more than just that type of pain, which I feel like that's something in school we didn't really, I don't know if I shouldn't say we didn't touch on, but I feel like it wasn't as expressed, like the treating the whole person, whether that's holistically. Some different models out there that I believe I've heard you guys talk about, like the biopsychosocial approach. Just knowing that it's not just all biomedical all the time, I think is something that I've been grabbing onto a little bit more as I left school.
Nice.
Awesome. Yeah. Is there certain like protocols or methods or ways they communicate with patients for types of pain?
Yeah, that's hard because sometimes, I mean, it's really hard. I think the biggest challenge is to when somebody's, especially when symptoms are lasting a lot longer than they want. Maybe somebody's coming in with pain that's been there for, we're talking some months to years, maybe like what I was going through. If I'm going from a year plus, as soon as they start saying that, I feel like it bleeds over in other aspects of life quite a bit. And then it's challenging to get somebody to buy into that. And that's, the conversation is huge. Building rapport is huge. I feel like relationships are big. Just because you need to have the trusting relationship if you're going to bring up some of those kind of topics that, and you can't really you can't throw them out right away. Like,
No.
it's not going to be taken well. I never want people to get the wrong idea or wrong impression when some of those things are brought up. But usually it's just one piece of the puzzle, and there's a lot of pieces.
Yeah. It's almost as if though the acceptance of even that idea can be difficult for patients too, right? It's trying to shift the framework of it's not biological anymore. It's such a tough thing for them to grasp sometimes too. So I know with the psychosocial model, people, even just to get them to understand the fact that you have to know it's now coming more maybe from the brain and saying it in a way that makes it sound like they're not obviously in their head crazy. That's never something I think people are ready to hear too. But so Doc, with your philosophy, has there been any types of postdoctorate training or even just docs or professionals that you follow that maybe have influenced your philosophy or your training?
I think today's day and age, it's really easy to find information everywhere online through social media outlets. Obviously, we're both active on them. I think there's individuals that I look to a lot on those outlets. Instagram is a big one. Obviously, podcasts like we are. There's a lot of podcasts out there. The challenge is to try and sift through and find the ones that are applicable to each person. I've been trying to get into reading more. It's one of those things where there's been challenging with the time. There's only 24 hours in the day.
Right.
But that's a goal of mine, I think. And whether that's leisure, whether that's for personal growth, I think those are two different ones. But I think for mentors, I don't know if I want to throw out so many names, but I think it's ones where I think I look up to the individuals that they don't always speak in absolute. So I like when there's things, they provide the information, you realize that they're not necessarily telling you exactly how it is, but they're providing the best information they can. Honesty is big. So some accounts, you feel like as long as they're doing their best to not just, I mean, I've been there and you want to build a following too, but at the end of the day, you want to provide credible information. I think those are the ones that I feel like they pop up more frequently for me.
Sure.
But other than that, no, I think those Instagram podcasts, I'm trying to get in the reading. I'd be lying to you if I said I've been super into it since I left.
Sure. Book or audio?
So I've been on the road a lot lately, putting more miles on the car. I've been on the audiobook trend, and it's hard because I keep hitting the rewind button. I'm sitting there, I'm on the road, and then 30 seconds to go by, and I forget what I just listened to, so I'm hitting rewind.
That's a tough one.
That's a tough. You know, I mean, I think it's one of those where it's efficient and effective, but it's harder to focus.
100%. Are there certain topics that you listen to or trying to read or learn from in terms of, are you talking more like personal growth, or are we talking straight?
I'll give you one example for both. So the audiobook right now is I'm listening to The Untethered Soul, which is the interesting one. It talks a lot about the brain, some different things going on, how we perceive life in general. But it's been interesting. I feel like it's a different ways. Like we always have voices in our head, one telling us one thing, the other thing. Sometimes it can get in the way. I feel like for me as like a therapist, it can be maybe part of the imposter syndrome, or maybe don't do this. Being told on the one side, this is dumb, this is a risk, don't do it. On the other side, realizing that those are your own like you can interpret how you want to react to those things. Sometimes we interpret it one way when in reality, like we're just digging ourselves into a little bit of a hole. I'm in the middle of that one right now, which has been interesting. I feel like it's unique. The other one was I finished Afflicted by Nicole Piemonte. It's a book. I read that one in person. That one just talks about the healthcare landscape in general. I would say how it's looked at necessarily, or how it's perceived, and how sometimes that as in healthcare, we can really almost, I don't want to say be damaging, but there's things that can be done that can really leave people with a negative impact, negative outlook on health, or just to provide the overall positive health experience. That one's an interesting one. I've seen that one recommended a lot. So Afflicted is interesting. I got it in my car right now.
Thank you for sharing. Now, I know with you, I'm going to dive into a little bit of like you yourself, as much as you'd like to share, obviously, but
Sure.
With you being a doctor and working a side business and having a family life, there's time management obviously is so important, but what does a typical day in the life of Landon look like? And I guess what are some of the challenges or some of the things that you feel like people can grow or build up off of what you do?
Yeah, no, that's a good question. A day in the life of me, I feel like I've been transitioning as you wear more hats. You have to try to make some changes when it comes to life. And I think with mine, getting up earlier, trying to get to sleep earlier, I'm promoting that 7 to 8 hours plus to sleep to everybody else, and I'm not getting myself. So that makes it weird. I feel like I'm trying to make that change. But I'm getting up earlier. I'm usually getting some sort of activity in lately, whether that's in a gym, whether it's out for a walk. Honestly, listening to these audiobooks on a walk with coffee is a great way to start the morning.
Nice.
But I also enjoy running recreationally. I feel like it takes my mind off things. So that's usually factored into my morning routine. But as I mentioned, during the week, so then I'll usually be heading to work. I've got a long day in the clinic, Tuesday through Fridays. I'm there from 10 to 6:30. At that point, when 6:30 hits, it's usually pretty exhausted. Come home, maybe get some stuff with the business done on the side, and then get something to eat, watch some TV, and then head to bed. But weekends are awesome. Weekends, I have the Mondays off, so Saturday through Monday. Monday allowed for a lot of flexibility with business stuff, but like you said, you're balancing a lot of things, and you don't want to spend, a lot of my business is run through the phone and through the computer.
Sure.
You don't want to be sitting there all day long when you have off day or you have time or you can spend with others. The challenge is time management and learning how to be efficient, which is absolutely impossible. It is.
We get it.
You don't want to see my screen time, so it's tough. But I think it's one of those things over the course of time, you develop your ways to get through it, and you find the time where you can do it when you're not necessarily interrupting time with others. And that's the tough part. But I think it is, exercise myself is really important while this stuff still, I need to get it done, but I also don't want to really sacrifice my own well-being, and work-life balance is still a big priority for me.
I'm sure that's changed as your career has gone on too. I know ours have every single day, almost weekly, trying to battle the challenges of getting stuff done and at the same time as trying to grow and build yourself up there. So are you more of a night owl, more early bird?
I would have said night owl for sure a little while back. That's definitely changing. I would say I used to be able to be watching TV and whatnot till 11:30, midnight, and no problem. And I'd be getting up at 7-ish. As that morning rising time is getting closer to 5:30, 5:45, definitely getting to bed earlier, but I would say being on Pacific time with all the sporting events ending earlier, that helps a lot. Yeah. Everything live off the TV is done at 9 o'clock, which is great, which makes it feel like I'm not missing anything. But most of my productive stuff gets done in the morning, that's for sure. Whether that's before work or on an off day, I do go into a coffee shop, hanging out and getting stuff done. I feel like it's relaxing and I can be productive there.
Love that.
That's it. I feel like that's changed over time myself as well. I used to stay up all night, and then school, obviously, study all the time. You're just always studying. But as I've gotten older, obviously, starting the podcast, it was 5, 6 in the morning, ready to go. I never on the weekends get there.
Yes.
It's definitely changing over time. But obviously, you talked about your side business, and I think that'd be fun to get started into that. So you're working at the clinic, but you also on the side, you are treating specifically pickleball focused players or patients too, I guess is my first question. And then how did you get into pickleball and why that? Obviously you have a baseball background, heavily baseball background. So I'm just curious on that too.
Yeah, I think you can chalk me down to one of those wants to stay competitive after their so-called and athletic career.
Yeah.
And pickleball, just a sport where it allows me to do that. And I feel like there's a lot of people that fit that criteria. But no, I had mentioned earlier that I had moved down in 2020, obviously being here in Arizona from North Dakota. We didn't really have, pickleball wasn't really super popular at that point. It took off down here. Everybody was playing it. I felt like it was a way to stay competitive, get some exercise, and then being in Arizona to get outside. I feel like those 3 things were super huge. And then once I started playing, there always was that thought of wanting to do more outside of the clinic and try and figure out what that niche might look like. Realizing that I spent time on a pickleball court, it was an easy decision transitioning to say, hey, you know what, might as well, if I'm going to be doing this myself, I might as well utilize it. And I feel like it was an area that a lot of people could benefit from. For sure. Those individuals maybe don't get quality advice, credible health information. And then I think it was some of those that I feel could benefit greatly from somebody providing a little bit of guidance when it comes to whether that's rehab, whether that's strength and conditioning, and just the basics. A lot of those folks potentially, it's not super ingrained in their mind as to how they can keep themselves healthy on the court, off the court.
And it's a new sport too. So I bet you there wasn't many starting a protocol for these people either, looking for, how do I up my pickleball game? Yeah, I bet you it was easy to find.
It was, there wasn't a lot. There was a few individuals that kind of, I would say, were involved a little sooner than I was, mainly the ones that I find online. And I think I've looked to them, I've used them as some mentors for myself in ways that they've handled things too. But I think it's one of those where, it was an option for me to feel like I can help more people. The online remote stuff, it's just been nice to provide the information to as many people as possible. And if somebody wants more info, they can come to me for that. But I think that part's been nice. And obviously keeps them very low when you're using in other avenues, that's great. The overhead is really low to nothing. But then it's more so just being in person, being on courts, talking with people, which everybody could do better at. But once again, there's a time thing of it can't be at every court all the time. Sure. There's stuff going on too. But no, I think that's what kind of got me into it. I think honestly, it was the matter of wanting to do a little bit more. I think everyone gets to the point in the clinic where you're like, man, I think there's got to be something some way I can impact others and benefit. A two-way mutual benefit for the most part of them and myself. And that's where I got into the idea of the remote stuff. And I do see some people hybrid in person. So I'd be lying if you meet some people on the court and they live here in Arizona. Usually I would do some hybrid form. Sure. Where I would see them in person for kind of an initial eval, some sort of mid-plan checkup, and then potentially a discharge. Nice. And the rest of it would be carried out online through an app, which works well. So
that's awesome.
Curious with the intensity of the sport picking up, and then also with the common injuries, especially you see from the physician standpoint and then also from the performance standpoint. So are there common injuries that you see with pickleball players? If so, what are the steps that you look at in terms of assessing, broadly speaking?
Yeah, there are a few that are really popular. I think the one that I usually go back to when it comes to the most popular injuries that we see in pickleball is just overuse stuff. And I know that's a broad term, but it's individuals that are playing 3 to 5 times a week, 60 to 90 minutes. They leave the court, they go home, do the rest of the day, they go right back after work the next day, whether that's shoulder, whether that's low back, whether that's knees, just some chronic stuff that just linger over the course of time. Some specific stuff would be, obviously, you see a lot of pickleball or tennis elbow. That's popular. I'm sure you guys see that in the clinic quite a bit. whether that's like the quick stuff, like a calf strain, I think is pretty popular as well. Calf, groin, hamstring. I think they're all there. And when it comes to managing them, obviously everyone's managed a little bit differently, but for the most part, I think it's the initial conversation of workload is one that I throw out there right away. What does you ask me what my day looks like? I've asked them what their week looks like.
Yeah.
And usually I would get, this game is like their identity where they're out there all day. And if they've been dealing with a knee or a back or a shoulder, they're trying to find naturally in today's society, we're looking for the quick fix of what's wrong with the shoulder. Let's get it fixed real quick. I got to play 3 hours tomorrow. It's like, wow, it don't work. But it's not going to be super successful. But the workload is huge because even just getting somebody to buy in on the importance of that, whether that's the duration, the intensity, the frequency, that's a big part of the initial convo, so the eval or the assessment. And then it's more so just putting them through a variety of movements to figure out what bugs it, what makes it feel a little bit better. I don't like anything else, any other athlete. I feel like although it's pickleball, people initially feel like, these people aren't moving around much. Like these people aren't super athletic. They can be, and I guess sports getting a lot younger and quicker. But for the most part, they're treated just like any other athlete, trying to figure out what makes them feel worse, feel better, and then do what we can to modify some of those factors and then trying to build on what you already can do relatively well.
Mm-hmm.
And I like the point that you said there. Like everyone's an athlete, and I think they might not identify or see themselves as athletes, even if they play no sports at all. But the potential for us humans, we're so malleable to whatever demands are placed on our body, and the fact that you can become an athlete at any age is cool. And I think that speaks to the pickleball itself, especially with a newer sport coming to fruition and other people in more of an older age can adopt that better. So do you tend to see more patients, clients, younger in age, older in age, or is it a mix?
I would say definitely the clientele is a little bit older,
Okay.
I would say, which I love. But I think it's one where, the definition of what is an athlete, I think that's a question that I don't know that everybody would give the same answer to. I think if someone wants to do anything that's a little bit more higher impact, that requires movement, whether that's running, jumping, turning, swinging a paddle, like I think that would be considered an athlete in my mind. And all of these, I think a lot of the individuals that I see, even if it's for performance based or just trying to stay healthy and play as long as possible. I hear that statement made a lot. Like, hey, you know what? I'm 60. I want to play till I'm 75. I see other people doing it. I want to play till I'm 80. Those patients are my favorite. They're awesome. And I feel like it's one of those where it's trying to build like a well-rounded athlete. So it's not just pickleball specific stuff necessarily. They're doing some movements that are very similar to other sports. It needs to be some things that are a little bit more challenging for the most part. And I think having somebody to integrate into some of those things safely is challenging, especially somebody that hasn't done it in a long time or ever.
Always.
But it's one of those, like, everybody can do it. I think, I don't know, I'm 30 now, which is crazy to think about, but like I keep telling myself, like, when is the age I'm not going to be able to run? Like, when am I not going to be able to sprint again? And I want that to be as long as possible, just because knowing that if I can sprint, if I can jump, that allows me to play a lot of these sports. And yes, I could get hurt any second that I walk onto a court, but I like to think it provides me a better chance to not necessarily have something that comes up as frequently as others. I don't know. I think well-rounded, just hitting all the areas, whether that's strength, whether that's power, whether that's conditioning, the sprinting and jumping for individuals is one where it's fun when the people can buy into that. Like I jump on a court or I'm moving around pretty quickly. Like I do run up to the kitchen line, or for those that know the rules of pickleball, they're doing it there. So I mean, why can't we train for it?
Really good point. In terms of training pickleballers versus rehab, and I know that periodization is different based on certain injuries, like you said, going through certain assessments, what can aggravate them at that time. I know we touched on the pain and just even the placebo effect and how you perceive pain as a whole thing itself that we don't have to dive into. But when you look at, especially when building out like a care plan for someone, is there certain things, markers that you're looking for to release them from care or release them from PT, but then to build on in terms of training them as pickleballers? No, they blend quite well, but how's that look like for you?
I think it's one of those where obviously in our profession, it's nice to be as objective as possible. Also sometimes challenging to do that, especially if I'm communicating through a Zoom call or some sort of video format. It's trying to get as much objective information as I can, to not even for myself, number one, but also to fall back on when somebody's been the the dog days of rehab. I don't know if this will get better. Are you sure I'm on the right track? And you can reflect back on some of those objective stuff you get early on, and whether that's movement assessments, whether that's just providing like a submaximal test of some popular movements, whether that's your classic goblet squats or hinge patterns, whether that's your classic, in my case, like single leg calf raises, just endurance test, whether that's to see if they experience any symptoms, if they're safe to do some pogo jumps or some light plyometric thing. I think I have in my mind and have written down as to how they respond to that. So maybe they do it well, but things aren't, it's something that I might revisit later in the midst of that rehab. But when it comes to when to look at a discharge protocol or a discharge plan, that one is hard too, because sometimes a lot of folks right away, they're dealing with things that they know that, hey, you know what, I want to play with this and I want to live with this, knowing that what are the odds? Is it going to be 100% gone by the time they're done with me? The honest answer is probably, it's not always yes. Like, it's not always going to be, hey, you're going to get out on that court and play pain free. It's more along the lines of you want to be able to play effectively and then not put yourself at risk for further causing troubles that are going to linger on for longer. So that part's hard, but I think the transition to some sort of like training program, it's the rehab towards the end stage, that should look a little bit like a strength training protocol or like a fitness routine, which I think is ideally everybody should be in that, especially if their goal is to do something that's relatively athletic. So I mean, it's more along the lines of transitioning the end stage of rehab, looking like a strength and fitness routine. And then right then it's ingrained into their routine and they're consistent with it, and they can carry that out, whether they need guidance from me or not. Sometimes people still do. That's usually a conversation I'd have with them if they feel confident doing it on their own, or if they, hey, you know what, I want to be progressed and regressed here still. I'm not quite where I want to get, or I just want to make sure I'm doing things the right way. Then I can still play a role in that. But usually it's a conversation I'd have with them.
You talk on transparency a lot there. And that's really all I like to talk about with patients. Would we like to get everyone to 100% every time? Yes, that's the end goal. But sometimes you got to be realistic. A lot of patients come in here with progressive neuropathy in their feet, and like, I'll get you feeling 25%, maybe 30% better. Is that something that you're okay with? Yes, perfect. There's just, I'm sure those times where you have to break it down and be like, you may have a little crick in that back while you're playing, but if you can still feel safe, confident, and effective at playing that sport, I'm sure that's something that you're having that combo with, and I like that too. Just especially as we get older, it's tough to get that full longevity back in the body, and healing as we age isn't as good as someone who's younger. But so my question, I guess I had with your toolkit, let's say you have a patient that comes in with epicondylitis or tennis elbow or something to that nature. Tricky for most providers. It can be really tricky. You want to give us just a rundown on what it would be like to manage in most case scenarios of lateral epicondylitis, because I think that's a pretty common one, like you said, and I think it'd be fun just to see what that perspective would be in your eyes.
Yeah. So I think Jace was showing like the pattern up when how it might show up or how it might present. And usually it's the repetitive backhand movement, whether that's pickleball, paddle, or tennis. Obviously, you guys know that. Listener may or may not. But it's the pain along the side of the elbow or the lateral side of the elbow there. Yeah, usually the first conversation I have, once again, is the workload. If somebody's coming to me, and that whether that's in person or whether that's remote kind of guidance, if they're coming to me once or twice a week and they're playing every day, the odds that we're able to make strong changes, if they're just continually re-aggravating it on a court every single day, is going to be challenging. At some point, that probably will include, that might be part of the plan, but early on may require a little bit of modification when it comes to playtime. Also, like the paddle grip, the paddle weight, that plays a role just because everyone's a little bit different.
Interesting.
Some things are a little heavier than others, so maybe some small modifications there can take the edge off, be a little bit of a modification to an aggravating factor. But usually it's one of those where right on, depending on how irritable it is, whether or not we can calm it down with some hands-on stuff. If that's in person, it might be some hands-on things just to take away some of the irritation, maybe loosen some things up a little bit, allow us to participate in exercise without it being super aggravated. Usually, maybe early on, if something's really acute, might be in play. For remote, a lot of those can be self-strategies. People can be taught pretty well how to utilize some of those things on their arm, whether it's with their own hand, whether it's with some sort of lotion they can use, or like a tennis ball, a grass ball, something that can get in and provide some pressure there.
Mm-hmm.
Usually once we get that rolling and we're able to start to incorporate some exercise, might be some light stretches, some light mobility work, and then eventually trying to load that baby up.
Yeah.
It is one of those things where you can do it kind of early, and we can do it to a point where we feel some stuff on that side as long as it stays manageable. Usually just trying to build the overall capacity of that elbow, knowing that when it comes time to play, it's got to tolerate a lot.
What are your favorite ways to load? Now, obviously, some maybe have bands at home, maybe some don't, but just curious, how do you effectively help them load with any tools that they might have?
Yeah. So, I mean, in person, obviously, you guys here and in the clinic, we would have a variety of stuff like the bands,
Yep.
dumbbells, like you mentioned. Both of those are fine. Otherwise, you can get creative. I have a lot of folks at home that I say use Walmart bags or soup cans,
Yeah.
non-perishable goods at home.
Yeah.
Like you
Milk
can
jug, baby.
find all sorts of stuff. Yeah, like I mean, you can measure out what is the milk jug? Is that like 8 pounds?
Is it?
It's 8 to 10, somewhere in there.
I'm
I could be
sure.
wrong. Don't quote me on that. But you can find some stuff around the house that qualifies as that load. And for the most part, what's challenging for somebody is what's important. It doesn't need to be a particular weight all the time. It's just one of those things where when we're doing something, we want it to be considered challenging while also being comfortable. I think just monitoring how we feel during and then after, then potentially that next day to see, hey, was this too much? What did we move too quickly into this? Or was this the right amount? Then maybe the next week or whatnot, we can try and kind of progress that a little bit.
Yeah. Awesome.
I like that grocery bag because I never thought about that. When we use milk cartons, if they don't have weights at home,
Yeah.
or some object of some sort there. But no, that's so smart. Now, I'm curious to pick your brain on this one. In terms of, let's say, person's feeling good, they're out of rehab, now you're just working on performance. Is there certain things that you think about in terms of trying to either apply or give them knowledge mentally or physically that can improve their pickleball game for performance, that is?
Yeah, I think it's trying to find a routine that works for somebody and knowing that everybody's different. That's also why I'm a fan of the remote conversation of the virtual training as well, because it fits in with their schedule. Everyone's schedule is very different. They don't have to necessarily, like some people they live away from a lot of these places where they might be able to receive care. I can fit that routine into their schedule, whether that's they're working, the days that they're trying to play. You can tailor it around that, which is super important. I also feel like I'm a big fan of making the hard days hard, making the easy days easy, where if someone's playing a long day on a court, or they're going to be active, doing a bunch of stuff off the court, and then they're going to play, maybe that's a day where you make it. It's a tough day. You get through some of your exercise that day, and you can allow yourself to rest after, knowing that the rest is super important. I think that's a mindset thing that I try and ingrain into folks, where resting is important, but then you also want to find time when you're going to get your exercise in. So maybe it's including it on a day where you're going to be active. But other than that, I think it's the big one that we hear a lot in pickleball is to try and get people to warm up before. When it comes to mindset component, just have that be in your routine of whether that's at home before you go. Sometimes people are only driving like a couple minutes to the court. They might not feel comfortable warming up like right next to all their friends or like right next to these people waiting. They might look at them funny. You can get a pretty good warm up in at home knowing that there's just a small little bit of a drive to get there. Is it super, super perfect? Maybe not, but it doesn't need to be. It's better than just leaving the couch or leaving the office chair and just hopping right on the court. So I think the other mindset thing would be just to get people to try and get some movement in before playing. It's not 100% bulletproof, but it likely is going to put yourself in a better chance to be successful, I would say.
With warm-ups, do you have a set of 3 or something quick? Because obviously just to warm up could be a task for people. So do you have something quick to be like, hey, if you're going to do it, at least try this? Do you have some go-tos that you think are good?
Yeah, I think initially, like any other sport, is just to get the blood flowing a little bit. Something to get the blood flowing, whether that's jogging in place, whether that's marching in place, whether that's jumping jacks, you name it, anything, whether it's a brisk walk or a light jog. It can be really quick. A couple of minutes probably does the trick. And then getting into something that's more forces you to move into positions you're going to move onto the court. Maybe it's some lunge variations. Maybe it's some rotational movements that incorporates both the legs and the arms, like a lateral lunge or a transverse lunge, and then potentially finishing with something a little bit more explosive. So maybe some like plyometric exercise where we're doing maybe some double leg or single leg jumps. Maybe it's a couple different shuffles back and forth just to, I would say, get the nervous system ramped up a little bit, knowing that we're just going to be, once you step on the court, you're going to do it. We might as well, once again, do it in a little bit more controlled setting before we get in there. I feel like it just makes sense. And there's research out there that maybe it's not super 100% how this is going to work for sure. But in reality, the numbers crunch where, hey, you know what, if we're going to be doing it in 5 minutes and there's going to be a ball coming, we have to react to it. We can prep ourselves a little bit ourselves before that happens in a much more controlled environment. So usually that's, I would say, a very quick run through, and each one of those categories, the movement, the mobilizing, like bursts or something a little bit quicker. There's a million different exercises you can put into those categories, and it's just a matter of finding which one works for you. And it can be different every time, to be honest, but usually people are a creature of habit. They'll find that routine and they're going to do it. You just don't make it the one that's, you just don't do anything.
An adequate time, you like to try to have them shoot for 5 minutes, or adequate would it be even more if they have the time?
Yeah, I think it's depending on what type of game you're going to be getting into. If you're going to be in like a really competitive setting, a tournament setting, you're going to want to spend a little bit longer than that. If you're playing rec with the buddies or the family, you can get a quality warm-up in for that 5 minutes.
Yeah,
and I no doubt that can be enough. And then usually when you step onto a court, you're hitting the ball around a little bit anyway before you jump into a game. That warm-up off the court, warm-up on the court, then you're usually ready to play at that point.
I love your mental mindset and process, because I'm always curious to see what people are thinking, how they go about to that conclusion. So obviously in terms of warming up, getting blood flow to the tissues, and then ramping up with some like kind of dynamic, not necessarily static stretches and different planes of motion. Then you ramp up more of a fast twitch, like you said, the nervous system, quick twitchy movements, and then applying more of basics of at the actual skill of pickleball with the ball. And I think that's the same for most high-end level athletes. You start slow, get the systems under control, then add in layers with that. I think using that in a warm-up setting, even in a training standpoint, is so smart. That's really cool.
I feel like a lot of people look at the pickleball athletes as like this different breed of people that just maybe can't move that well. They don't do that well. When in reality, we're just like everybody else, just like that baseball player, just like that basketball player. The demands are a little bit different for all those sports, but in reality, like the warm-up routine, getting things warmed up, ready to play, it does look very similar, or it should look very similar. And then when you get to that last stage, or that end stage, when it comes to actually being on the court, that's where things change a little bit. But the beginning stages, like science would tell you, that it all looks pretty similar for the most part.
100%. Now that's so cool. And I'm sure that let's take almost a step backward, because obviously for you being a physical therapist, you work with post-surgical cases, I'm guessing mostly. You want to explain what your role in clinic looks like? Because then I know there's a few questions I want to dive around through there, and then we can tie in a few other things. But
yeah, I think in the clinic, when I'm there Tuesday through Friday, the clinic setting would include a lot more of the surgical cases, knowing that those individuals would benefit greatly from the hands-on care, have somebody be there in person to be able to guide their plan. So a lot of cases, if I'm seeing post-surgical people, it will be in the clinic. And a variety of stuff. I'd say the most common would be rotator cuff repair, if I had to guess. And it's just individuals, whether they had that rotator cuff tear before they started playing, whether they started playing, the shoulder started to bother, they found that tear, and then they go get it repaired. Who knows what came first, the chicken or the egg? We won't ever really know that, unless it was traumatic and they fell. I think those do happen too, where if you have that fall, we have that tear and it gets repaired pretty quick. But when it comes to management of that, yeah, I think you see them through the whole course, one of those things where you decide mutually when it's time to finish that. But that would be a lot more in person. And honestly, if people reach out virtually when it comes to that, and like through an initial conversation of 15 minutes, just trying to get to know them, having them get to know me, like if it's not a fit for everybody. I think that's super important. Like that 15-minute call does not mean you are signing up for your life to be a virtual rehab client. Like that's not how it works. And in a lot of cases, people can benefit from the hands-on care of being somewhere in person. Maybe when they get through the initial stages of rehab and they're comfortable with their plan and they're comfortable with how they feel, that might be a transition they want to make at some point, just to be more flexible and have it work with their life. But early on, I think those cases are huge to be in person. Just feel like it builds confidence. You can keep a little closer eye on them. And then if there is hands-on work needed in those cases, I think the in-person care clearly is important for that.
So smart. With specific rehab cases, I know you brought up shoulders, which obviously for any type of movement, throwing, hitting objects makes a lot of sense. Do you look at the rehab process like mentally in your mind of you want to target certain tissues, whether it's ligaments, tendons, muscle, bone to a certain extent, joint capsules, and does the training or rehab fall in suit in terms of an order? Or do you look at MRIs or obviously movement scans, but does your mental mindset and process go towards as specific tissues?
Yeah, ideally, there's probably a combination of all of it. In those cases, when they are post-surgical, we usually have the surgical report. So you can see what that looks like, what areas were affected necessarily, how it went in most cases, and you get a picture into that in regards to the tissues that were affected in that at that point. Also, like we talked earlier, like sometimes when it comes to a rotator cuff repair, there's other areas that are involved there too, like you mentioned, where yes, they might have just repaired the supraspinatus or infraspinatus, whatever rotator cuff tendon they repaired, but that doesn't mean that there's not going to be associated stiffness, tightness, irritation elsewhere. Oftentimes there probably is. A lot of swelling might impact that. But I think it's one of those where in the early stages, like you mentioned, you can still have a positive impact elsewhere. So, I mean, with the shoulder, maybe you can still work on, maybe it's areas of the chest, maybe it's areas of the spine, just to get somebody moving early, knowing that timeline is not necessarily going to be conducive to getting overhead. But to get the arm overhead, there's other components in the body that have to move. I think it's, when it comes to tissue specific, a little bit of everything. When it comes to the chest, you're looking at some of the muscles and tendons or whatnot. Same thing with the upper back or lats, whatever. I mean, muscular for the most part. But healing timelines are important. And usually everybody in our fields have an idea as to what that's going to look like. And you want to accelerate them a little bit to a certain extent. But at the same point in time, like there's timelines where those first handful of weeks, they're going to be locked up in a sling in that case. And we try and find ways to be productive while they're still there.
Nice.
Do you end up talking to the surgeons directly, or is it more you just get some of the information via the scans? Or I've never asked that question before.
And I think my background in the hospital-based outpatient ortho setting is there's in-house, the surgeons are in-house, they're contracted in-house. They're not necessarily employees of the hospital, but they're contracted through the hospital where it's the same surgical group that does a lot of procedures. In those cases, their surgical notes are in their file. I can see they're just come right through. So when I see that individual, or before I see them, as I'm reading up on them, those surgical reports are there. So if they're not, let's say it's somebody that gets a procedure done and let's say back in North Dakota, they're down as a snowbird. I don't have any information on these people. I know they're coming in with a rotator cuff repair, or they might come in and they have a ham referral that said they had a rotator cuff repair. So I have no time to prepare at that point. Then it might be one of those where I'll say, hey, I'm going to reach out to the surgeon. I'll maybe get in touch with the MA and they'll provide me like just some basic precautions if there is any. Some surgeons have strict protocols. Ideally, today's world, they're a lot more lenient and they say, hey, you know what? We trust you a little bit. Maybe you can take this and treat them as you see fit for the most part. So there's not as many definitive protocols necessarily, which is nice. Just knowing that everybody's different and everybody's level of fitness is a lot different too. So those can change, which is a new thing, I feel like, in physical therapy, probably chiro world, where it used to be really cookie cutter. Like, man, you got to do this week 1, 2, 3, 4, and they got to be here by week 8, where now it's a little bit more lenient. It's not quite as cut and dry.
Custom too, right? Yeah. We talk all day about that, right? Because everybody is different. I'm glad you brought that up too, because, with chiros, we do have what we would call a separation of practice between providers. There is some different philosophies compared of one to the other. And so when you talked about that, going from cookie cutter to specific, I guess my question to you is, do you feel, or do you know if that's similar to our provider? Do you feel that there's like a separation of identity in physical therapy practice? And if so, are there ways that PT practice one versus the other? And is that multiple, or is it pretty similar across? And just maybe give us some insight into that.
Yeah, no, big differences, which maybe you guys are respecting that. But I think I look at it, if somebody asks me, like even a patient sometimes will ask me that, of like, is there differences between you and this individual that's treating 3 tables down? And the easiest answer is yes, there's a lot of differences. Number one, he's a different person than me, and I have my own strategies of how I talk and how I go about it than he is or she, which is totally normal. And I'd compare it to any sort of profession for the most part, whether you're in the service industry as a server or a cashier, you work on the phones, like you're going to do things differently than the person next to you. And it doesn't mean that it's wrong necessarily. I feel like, unfortunately, there's a lot of times, and I have to catch my biases too here. If you're not treating like me, you got to be treating wrong. There's no way what you're doing is right. And that's just not super healthy, not productive for the field, not productive for the patients for the most part, as you're putting those beliefs in their mind. But I guess going back to it, a lot of differences, whether that's individuals that are trained under different schools that generally teach a different train of thought. And if somebody goes through one school versus the other, we're going to come out with a little bit of a different foundation for the most part. And I think that makes us unique and, once again, not necessarily wrong. And I think as the years go on. I think, like I mentioned earlier, like adapting to different things or different information that comes out is huge. And obviously everybody should be doing that to some extent. So I think the only trouble is when somebody maybe is doing things that are maybe super outdated in the research, proven wrong and wrong. And I mean, do our best to integrate it the best we can. Obviously, it's not going to be perfect all the time, but just acknowledging it, I think, is important. Sometimes I feel like you can see folks that maybe don't, it's their way or the highway. They've been doing it for 30 to 40 years. And you know what? They're not going to change.
No.
At that point, like maybe there's differences there that I'm okay with saying, hey, you know what? I don't necessarily treat it like that. And I think it's okay to say at that point, as long as you have good intentions behind it. But yeah, like I said, moving towards more of a treating the human as a whole versus really just locking in on that biomedical. I think that's one of the big things I see that's different. You can see pretty quickly if someone's building relationships and really focusing on those other things like sleep, diet, nutrition, hydration and whatnot, rather than just looking at that one particular body part. So I respect the heck out of those that kind of look at the individual as a whole rather than just focusing on that shoulder.
So rehab only versus maybe a holistic kind of idea is what, in a way.
Yeah, that's a big difference, I think, with individual, probably practitioners of every single field, whether that's PTs, chiros. I'm not sure there's doctors that are the same way.
For sure. Absolutely.
They use their words very well and they're super positive with those. And they're cognizant of the verbiage they use with the patient when they're providing education. And there's other ones where you get them from that doctor's visit and you just hear some horrifying things. Man, you get an interpretation of what that individual is like just based on the conversation you have with the patient, and they were with them for 5 minutes.
Yeah.
So I guess I have an idea that if you're telling them that their knee is just totally wiped out and shot, that's the worst one they've seen in 20 years. Like they may have said that the last 30 patients, but it scared the heck out of this one.
And you just ruined their life in 5 minutes. We talked so much on words, man. One of our podcasts, we did pretty much dive right into explanation of the treatment that patients get from one nephrographer to the other. And we hear all the time as chiros coming into patient maybe like bone on bone knee pain, and we do x-rays and no bone on bone, and just all these other differences where the second they are mentioned a phrase that can deplete their wind and just their sales are down, it only makes our job just 10 times harder too. And so I love that you brought that up, because day in, day out, that's something that we work so hard on, is making sure that the words that come out of our mouth are the ones that bring down their fear and bring down their barriers. Because, some people don't even want to use the stairs anymore because they think that one time they used the stairs irked their knee and now they never want to do it again too. So yeah. I love that you brought that up, because that's so true.
And to go off of that too, and I know this, going back to the previous point, and I want to put this out there because I think it's very important. So obviously physical therapists and chiropractors, they should absolutely gel well with one another, but I think most people should go into physical therapy, whether they're in pain or no pain, because especially like what you said too, Landon, where you look at the holistic approach of the body, the certain aspects of sleep, the times that they're performing activities that re-aggravate certain injuries. I think it's all so important. But for chiropractors listening, I think if you're just doing adjustments, there is so much that is left on the table that you can benefit for all patients. And I think it's, to a certain extent, with chiropractic, we're getting movement in certain areas that are fixated. Obviously, it can help other organ systems, neurological functions as well. But unless you involve the muscles and the tissues on the same time, we're not necessarily correcting too many problems with that. So I think that's something that whoever's listening, you have to pay attention to. Obviously, certain disciplines have their place, but I think when you look at healing the body as a whole, going from more of an integrative approach is so important. And going back to my point, I think most people should have physical therapy, pain or not pain. Landon, what's your thoughts with that?
Yeah, I think I agree with that wholeheartedly. Just knowing that there's things that we can do similarly. If you spend the whole time with an individual just locked in on one thing, whether it's one hands-on approach, one manual technique, and then you get them out the door and they're back with their regular life, whether that's at work, whether that's at home watching TV, the benefits, you're losing a lot. I think it's one of those where if you're going to maximize the effect that you're going to get out of a treatment, there's some other things that you can add to that, like you said. And I think all of our professions can do that too. PTs can definitely prescribe exercise. Chiros can prescribe exercises. PTs can work on manual techniques on a shoulder to try and relieve some symptoms and try and loosen it up. Chiros can do the same. I think it's one of those where That's not necessarily profession specific. I think it's, as the evidence probably shows, or evidence does show, like when you include multiple different things into one intervention like that, you're probably going to get the best outcome.
I know you brought up a lot about pain science and education. And it sounds like you've obviously worked hard at reading and understanding how to talk to patients, which I absolutely love. I'm just curious, is there anything else that fascinates you other than just the typical anatomy and physiology that you got in PT? Are there other areas of the body, or I guess studies of health, that you've gotten into that you found really gelled well with what you're doing?
Yeah, I think the big one, maybe we haven't talked, I touched on it a little bit. Obviously, the pain is important. It's cool. It's very unique. It's exciting, really frustrating. So, and that's all those different things.
Oh my gosh.
But then you mentioned, yeah, obviously we get a lot of the anatomy and phys stuff at school. I think just seeing things like seeing how other things impact. I know I don't want to keep harping on the biopsychosocial approach, but I think it's like
bring it up
of the boring thing, like the boring things, how much it can have a positive impact on recovery, even as simple as sleep. Like I look back at when I was dealing with stuff back in the college days, like I was sleeping like crap, to be honest. I was out all night and I was eating terrible, and maybe I wasn't putting myself, my environment that I was in was not really conducive to feeling better. And I was pointing at one professional, the next professional, this doctor, saying, man, you're supposed to be helping me. You're not. You're not helping anything. And I just wasn't aware. I don't know that I was told that necessarily, which maybe I was, and I was 19. I didn't listen to it, but I don't think that's super uncommon either. But like that 7 to 9 hours of sleep, like the studies that show how much the athletic performance, how much it increases after like you get that 8+ or 9+, whatever it is. And then the sports teams that really implement that with their athletes is super cool, I think. And yeah, coaches say it all the time, but if you really mean it, and if you really make it a culture thing of, hey, you know what, we're going to be doing these things to try and optimize our performance and then honestly optimize your health. I think it's something that if you get the athletes to buy into it, which is super hard, there's a lot of fun things you can do when you're 19, 20, 21, but if you want to play well and you want to play healthy, I think those types of things, those studies are cool to me, just because I reflect back and realize maybe I wasn't doing any of them. So
we know none of us was ran. None of us earlier.
Jace was.
Was he? Were you?
No shit.
It's hard. There's so many things, like, yeah. Or it's like studying all night. Man, I'll pull all night like crazy. You know, I think it was fun at that point. Like, you'll riff a few energy drinks. So
yeah.
You have the test at 8 a.m. You go take the test and you go to practice.
Pay for it later, right?
You go lift after.
Yeah.
And it's just not super. I wonder why my back was hurting all the time. Makes sense.
You brought up sleep, because obviously it's so important, but do you ever prescribe your patients, clients, like naps or medication at all?
Oh, that's a good question. I haven't. So meditation is one thing that I'm trying to look into that more. I'm interested. It's a topic that honestly, like when it comes to, I've just taken my first couple yoga classes. I never really done it in my life.
Yeah.
I think it's something that I have definitely, there's room for improvement when it comes to just basic mobility, number one, but then also being able to shut your mind off at times. It's intriguing to me, like the naps and meditation. Have I prescribed it? Not necessarily, but when it comes to like stress management, like when it comes all these other factors that play a role in pain and injury, obviously stress management fits right in the mix with the sleeps, the diets, the hydration. What can we do to manage our stress? Sometimes we can't quit our job on the spot. If our job is stressful, we got to go to our job sometimes. Ideally, find something you enjoy, but if you can't modify that, then finding other ways, or if it's family life, super stressful, maybe it's a couple minutes in the morning or after we eat or we get a lunch break. I'm interested in the meditation, and I know that there's been some good info out there and how it can benefit people. I haven't prescribed it a lot, but I talk about it as one of the strategies we can use, just because it's something that's effective and everybody can have access to it. It's something that costs a lot of money. Sometimes you can buy an app or whatnot that can help, but otherwise you can do it on your own, whether it's in your office, in your house, in your car.
Yeah, for sure.
100%. I know, like we've touched on this before in the podcast, like yoga nidra. It's almost a type of like meditation that you get into a restful state, but they've done studies on that. You can get into the first 2 cycles of sleep, which can help for like growth hormone factors and a bunch of other recovery aspect tools, even like neuroplasticity too, which is learning, if we will, for those that are listening. But put this in, I was thinking about this podcast last night, and I know you being consider us nerds, and I'm fine with that, but what fascinates you about anatomy and physiology, and are there certain structures that you want to learn more on? For example, like I'm curious on the rehab of the clavicle and how the subclavius, which is the muscle right underneath the clavicle, on how that deals with and helps with the function of the shoulder and then the jaw. But is there certain body parts or things about physiology that fascinate you that you're curious about now?
Yeah, I think there's a lot of information that comes out when it comes to how the body can heal itself. Like obviously we're a living being, that things are taking place in the body that we maybe didn't know about in the past, where that's like some non-surgical options for things that over the course of time they might find their way to find themselves being able to heal. Obviously, you see more information out nowadays of people that are trialing ACL, different things like, hey, is it automatic? Like we have to go get that ACL repair immediately or within a couple weeks after an injury. As more info comes out, right now it's still maybe unclear, but it's not super definitive. Hey, you got to do it. Like there might be other options out there. I think that's just like the body's dynamic way of being able to do some things that are pretty wild. Or similarly, like people living with these rotator cuff repair or rotator cuff tears for years and years with having zero functional limitations and having no pain. I think similarly, like everyone's different and the environment that we are in might lead to some of those things. But I think those types of information are interesting to me, of finding new information that comes out that says, hey, you know what? The body can do things that we maybe didn't even know about. And now it's a matter of putting it to, obviously, more tests, more studies probably required. But at the end of the day, like somebody mentioned to me, like for the ACLs, they're like, wow, the studies are coming out showing that we don't always need to get the ACL repaired. But what happens if in 3 months I try and treat myself, or I try and rehab non-operatively and it fails, then I have to go get surgery and I'm now 3 months behind? The counterpoint to that was like, what happens if you go get surgery on day 3 and 3 months down the road you have a re-rupture or the surgery fails? Would you be upset in that case too? Because it's definitely a possibility on both ends of the spectrum. Medicine's not perfect, but I think as long as somebody has all the options on the table and they can make an educated decision, I think it's interesting to look at it that way. Would you be upset if you didn't get surgery 6 months down the road? Or if you get surgery and it doesn't quite do the trick, would you be upset 6 months down the road? Like, you're probably going to have some varying answers.
What if? Never a good one to play. Okay. Sometimes it's just the educated guess, go with it. And the more time you spend thinking about it, you're just losing time anyway.
And I don't know have you heard of the Connor McDavid, like hockey player, his story when he blew out his knee?
No.
Dude, it's that. Okay, I think we have that in past podcasts, but I think this was about 5-6 years ago. He went in, like skater player tripped him. He went knee into the post. He ended up tearing a PCL, ACL, fracture the tibial plateau, blew out his whole posterior capsule. And this is a point to where like he had to figure out and decide, does he go surgery or does he not? And he saw a bunch of different specialists and he ended up not going the route of surgery, which is crazy for all those injuries. So long story short, he went into hyperbolic chambers every single day, multiple times, and started doing like isometric contractions, nice, light and easy, maybe 25% intensity or so. Then they pretty much re-imaged MRIs every like couple weeks, and they're wanting to know, does the ligament go and attach itself? And they noticed that, God, I think it was 6 weeks later that it started to attach. So then they started loading, and it's still hyperbolic chamber, start loading in the pool with weighted vests, so a small amount of pressure against gravity. And then they built it up from there. They added other like aspects of plyos and skating coaches, gymnastics. And dude, you have to look into that. Like that story is crazy. All the injuries in a non-operative approach. And I like going back to your point, like with surgery, are you okay with possibly having it blown out again, possibly having another surgery, or without any hardware put into your body, can you rehab this without any surgery? So I think that's so cool. But man, dude, you got to crazy.
I will review that. Those stories are unique, and especially somebody of that caliber to do that is super cool. And I feel like obviously it can be an example for others when they see these idols like that. I heard he played pretty well in the NHL playoffs this year, so maybe he's well. Yeah. No, that's cool. I'll have to look into that. Yeah. Not as good as the finals, apparently, but you think the playoffs would be nasty.
I agree. It's almost too soon. So those are I'm a pretty big Oiler fan. I've been watching Connor McDavid his whole career ever since he's like 15 years old. And yeah, they end up losing in Game 7 after coming back from a 3-0 deficit, and they only lost 2-1. So it was rough, but man, yeah.
Okay.
Yeah.
You're obviously a humble man, so this next part might be tough to get some stuff out of you, but we're going to try our best because I tell you what, man, you've done a really great job so far with growing your channel and just trying to help as many people as you can. But we're just curious because we always like to talk about just habits and goals and just trying to grow those kinds of things too. So just curious to get your take on some things, but obviously you've been featured in several well-known media companies, articles, those kinds of things. We're just curious, what was it like to gain some notoriety for your work, expertise, and then just how do those experiences unfold?
I think it's similar. I mentioned earlier, like the imposter syndrome when you leave school is a real thing. Am I doing the right thing? Yeah, I think I should be doing something different. Am I even helping anybody? That's a real thing when you leave school. And I think some mentors helps a lot with that to try and get over and overcome that initial fear. Feel like it started all over again. You just enter this online space and maybe start a side business that you have no idea how it's going to go. And my biggest fear was like, I don't want to start this thing and just punt after 3 months. Like you see a lot, like you get that initial rush and then it's just fizzle out. Like I think the competitive feel like wasn't going to allow that to happen.
Yeah.
Just like if I start this thing, I'm gonna at least give it a couple of years. I'm gonna see what happens. I think that was challenging, but also super important. I think it's also having people in your corner a little bit that have been through it. At the time, I would say the biggest mentor that I had was a coworker of mine at the hospital.
Okay.
And it started as his kind of side business working with ACL clients. I'd say about 6 months to a year before I did. So I watched the initial stages unfold, watched the challenges, like saw him be like, man, it's 3 months in and I don't have a paid client. What am I doing here? But knowing that you just have to build a foundation at some point and then things will come, as long as you handle yourself appropriately and you feel like you're providing value, like things will eventually unfold and the opportunities will show up. So I think for me, it was, just getting the ball rolling, being consistent, that's the hardest part. And then not really throwing in the towel when things get a little bit challenging, knowing each month is going to be different, which is that's not unexpected, but also can be frustrating and can provide some of that fear of, is this for me or not? But I think once things start to develop, once the name gets out there a little bit, people are more familiar with it. It's not such a shock. Like for a while there, every time I had a conversation with somebody, it would come up and it would be a laughing matter of, man, pickleball physio, what is that? What are you trying to do with this? And now over the course of time, it's become, I don't want to say it's like an identity, but at the same point in time, it's just people know it and they know what I do. They know the stuff that I'm putting out there. Not a shock anymore. And then I think that helps me with not having to have that conversation with people all day, every day. All right, this is what I'm doing. This is what I'm trying to do it for. I think as time goes on, that part becomes so much easier because the explanations are a little bit less and people just have a better understanding of kind of what I'm doing.
Awesome.
Love that too. Like when I saw you pick up pickleball, I thought that was so smart. Coming down, obviously, we were curious on like where your mindset is and why that shift is. But when you look at a growing sport, we look at
I think it was the
Arizona.
fastest growing sport, wasn't it? Yeah. For sure.
Yeah, it's up there. But then you add in the lifestyle factor in Arizona that you can compete almost all year round. So that makes sense there. You add in the physical therapy component of rehab and then performance, like makes a lot of sense. And I think you're going to do awesome moving forward. And we're honestly excited to watch you and help in any way that we possibly can for your growth. But in terms of growing your channel, what lessons have you learned? And then how's that helped you moving forward? And what are the biggest obstacles you had to overcome in that journey?
Yeah, growing the channels is hard. It still is hard. I think the timing is challenging because there's a lot of folks there, the same mindset. Hey, it's a good time to maybe start an Instagram account in some capacity, which I think that part's challenging, knowing that there's it's getting more saturated, I would say now, and I continue to deal with that challenge too. But I think the consistency I mentioned is huge, or was huge, but then it's along the lines of trying to learn the ins and outs of it, and whole new technology that I wasn't super familiar with. Like I'm not big active Instagrammer on my own account. Like I have my personal account, but I'm not on it that much. I'm not big into editing videos and writing captions. Like all that stuff is so different. I mean, it's like different than physical therapy in a sense. Like it's a completely, yes, you have to be well versed in your field and your niche. At the other end of it, you have to know how to work these new apps and technology that you've never had any experience with in your life. That part was really hard when it comes to the growth component, or even just continuing to produce things. But I think consistency is huge, and just having stuff to put out there that people can relate to, and then trying to figure out how to deliver it in I would say, an easy on the eyes manner is seems like it looks professional, even though I'm doing it from my couch. It's challenging, but it's also rewarding.
So with that, have you got a chance to dive into any of the AI stuff? Because we're trying to optimize all of our systems, and it's like going back to what you said in terms of the time aspect. Like for us, it's like mixture of life, like personal life, video editing, podcasts, and then it's the work and the repeats. It's never ending. But I think now AI and tools are coming to fruition. Have you got a chance to use any of those or dive into any of those?
Yeah, I think it's going to continue to become, or it's going to be an asset people can use, no doubt. It's not going away. I remember when it showed up, probably, what was that, a year plus ago, year and a half. It was exciting, not really knowing if it was going to stick around. Obviously, it's going to stick around. I think I use it for a lot of like ideas, maybe topic ideas, content ideas. Maybe it's like laying out some sort of plans that you can come up with them real quick, and you can be pretty dang detailed in regards to which ones you want.
Yeah.
Obviously, at some point, it can help with various topics in captions. It can help with some different things of that. I'm assuming there's ways people integrate it a heck of a lot more than I do. And it's one of those where same thing, learning a whole new technology like that, getting in and out, or the most value out of AI is probably a whole topic in a class you could take on itself, which I have taken. But at some point, if it sticks around longer, and it might be worth it. I know a lot of people use like different bots to send information out, or like mass produce, just whether that's flyers or sending out links. I haven't done any, I'm not certain how that works necessarily, but I know there's other accounts that utilize it. And it probably saves a heck of a lot of time to be able to do that. But someday I think it's worth it if things continue to grow and it gets out of control and I can't handle it myself. I think
It's coming, man. You better be careful. It's coming. You better watch out. You say it now, but you better get going.
Everybody get on top of it or what happens. But I think it's like one of those where the fear of the unknown of, I don't know how much. Yeah, I don't know how much it can impact a business for that matter. I know it can, but you just don't.
Yeah, so worries, man.
Even on that topic, for those people that are listening, if you look up anything medical, some of the information is not always 100% correct, especially if you're just asking generic questions. Just food for thought there. The in-person medical practitioner that's been to school, for now, that is, in 2024, is still top tier.
All that gold standard.
Yeah,
but
just don't want to let that get to waste on that one. But yeah.
Well, Landon, we really appreciate having you on the pod today. We always just want to end with anything coming down the pipeline in the next months, years. Just curious, what's to upcome for you, and then how do folks find you too?
Yeah, no, I think I have. I don't know how much to divulge, but I think I have an exciting, hopefully, sponsorship / partnership coming up with Pickleball Company.
Awesome, man.
I've been waiting for it to come to fruition.
Yeah.
Be able to be publicized. So I think that's hopefully very shortly here, which I think would just allow for a little stability, also provide a little bit added motivation to continue to produce some things. Also probably improve or expand the audience to be able to see my stuff, which is awesome. I'm excited for that. But otherwise, no, I think the summer it's an active time here in Arizona for pickleball, but also active for the country. I think Arizona's quiet outside. These pickleball courts aren't quite as busy during the day, but I think about nationwide, like my family, my parents, they're playing regularly because it's summer up there.
Yeah.
Although it's quiet here, it is not quiet out there. So I think that's something that I always have to keep in mind on. But hopefully when people come back down in the fall, populations go up a little bit. The popularity is going to continue to rise, and then try and find ways to get into some of these settings where people can benefit from these type of services. I think that'll be the goal of the next couple of months, is to prepare for that, and then feel like I have a plan in place to be able to execute it. But also challenging, and trying to enjoy the summer too a little bit. A lot of travel coming up, so I'm excited for that.
And Pickleball Physio is how they find you, correct? That's your handle?
Yeah, the Pickleball Physio on Instagram is usually the main one, but then have the website that's up and running.
Cool.
I'd say those two are the most primary forums at this time.
Look to the description below. We're going to have all that. So if you have questions, comments, or if you're in pickleball, by all means, he's a wealth of knowledge with everything, obviously, from the podcast. If you've been this far and listened throughout, you've picked up, I'm sure, a few gems with that. So yeah, no, thank you guys. Thank you, Landon, so much for making time. We appreciate you for all you do.
Yeah, absolutely. Thanks, Dan, for having me. I enjoyed it. Went by fast. I don't know how long it does kind of cruise. You were telling me it was going to happen good.
Well, we appreciate you. Thank you so much. Everybody watching, we appreciate all of you. And until next time, Doc, You guys later.
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate, and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the functional code. Until next time, stay well, stay informed, and embrace the science of living well.